Good afternoon to everybody. Here Raju sir from the Department of Anatomy. Brief you about the integrated teaching of bones. Objectives of today's lecture as a part of integrated teaching are introduction, functions, embryological source of bone, parts of bones, laws of ossification, blood supply of bones, classification of bones, and applied anatomy. And specifically microscopic study of bones, compact and cancellous bone. Composition of bones will be in detail explained by biochemistry department. Ossification of bones, intramembranous and endochondral, growth of bones, and factors affecting the bone. Introduction. Bone is mineralized dense connective tissue made up of few cells in mineralized matrix, consists of 30 to 40% of our body weight. Is a dynamic in nature, and functions we'll see. It's a framework of the body which includes the skeleton, which is a supporting framework of the body. Attachment of muscles and tendons permit the movements in the body parts, protection of organs, hematopoiesis, reservoir of minerals and fat. So here the biochemical role will come, reservoir of minerals and fat. Parts of bones, epiphysis, secondary centers will be appearing commonly, and there are the epiphysis types: pressure epiphysis, traction epiphysis, and atavistic epiphysis. As you have learned already, we just brief you in this integrated teaching lecture. Diaphysis appears the primary center in the diaphysis and the strongest part of the bone. And here you can see in the diagram epiphysis and the diaphysis as well. Then the metaphysis, epiphyseal ends of the diaphysis, called as metaphysis, and the maximum blood supply will be present at the level of metaphysis, and epiphyseal plate of cartilage separate epiphysis from the metaphysis, and the maximum growth occurs there in the epiphyseal plate of cartilage. So the common disease at this level are osteomyelitis in children. And the medullary cavity filled with the yellow marrow or bone marrow in adults and lined with endomastium. Here you can see the diagram, so medullary cavity. The principles of ossification. Primary ossification center before birth, which appears, is called as the primary ossification center. Secondary ossification center after birth, which appears, is called as secondary ossification center. Ossification center which appears first is usually last to fuse except for fibula. In long bone with single epiphysis, that epiphysis is at the movable end. Continuation of principles of ossification. Larger the epiphysis, earlier the ossification center appears in long bone. If epiphysis develops from more than one centers, the various centers coalesce before union occurs with the diaphysis. When epiphysis fuses with the diaphysis, the growth ceases. This fusion occurs 1 year earlier in females than in the males. The blood supply, usually nitrient artery, terminates in the adult metaphysis by anastomosing with epiphyseal, metaphyseal, and periosteal arteries. Supplies medullary cavity, inner 2/3 of cortex and metaphysis. Periosteal arteries enter the Ockman's canals, supply outer 1/3 of the cortex. Here you can see the nutrient artery, how it is dividing into branches, how it is reaching the ends even. And the metaphyseal arteries, branches of nutrient artery in this highlighted diagram, you can see periosteal arteries. Again, you can see the compact bone, the periosteum, metaphyseal arteries, articular cartilage. Classification. Under classification, we have a regional classification, microscopic classification, and the shape. According to shape of the bones, also classification is there. Regional classification: axial skeleton, which consists of 80 bones, and appendicular skeleton consists of 126 bones. Totally 206 bones are there in our body. You can find it the axial skeleton and the appendicular skeleton as well. And the microscopic classification: compact bone and the cancellous or the trabecular bone we call. Developmental classification: membranous bones, dermal bones, cartilaginous ossifications or cartilaginous bones, and membranocartilaginous bones. From both achondroplasia and cleidocranial syndrome are the clinical aspects regarding this. And bone shapes: based on bone shape, Long bones, short bones, flat bones, irregular bones, sesamoid bones, pneumatic bones, and accessory bones are there. In this diagram, we can see the long bone, flat bones, sutural bones, irregular bones, short bones, and sesamoid bones, and there are pneumatic bones also. Microscopic study. If you observe the cellular level of the bone, osteogenic cell, osteoblast, osteocyte. Osteoblast will form the bone. Osteoclast will destruction of the bone. Okay, it will be helpful in the destruction of the bone. You can see the cellular variations: osteogenic cell, osteoblast, and osteocyte. Osteocyte is this one. Then bone cells. Again, repeat: post osteocyte, mature bone cells we call them as, in lacunae and connected by the canaliculi. Osteoblast, osteogenic cells, contain alkaline phosphatase and pyrophosphatase. Osteoclast will help in osteolysis. Osteoprogenitor cells differentiate into osteoblasts. Again, you can see osteocyte, osteoblast, osteoprogenitor cell, and osteoclast. The compact and the spongy bone, trabeculae and osteum, can be seen. In the section, we can see the osteocytes, osteoclasts on the periphery, and interstitial lamellae, lacunae. This section of the bone. Compact bone located where stresses are limited in direction. Spongy bone located where stresses are weaker or multidirectional. Periosteum, superficial surface of all bone except in joint cavities. You can locate the periosteum. Provide route for blood and nerve supply. Participate in bone growth and repair. Outer fibrous layer and inner cellular layer. It consists of two layers: outer fibrous, inner cellular. Perforating fibers called as Sharpie's fibers. And here you can see cellular layer of periosteum and the fibrous layer of periosteum. Then endosteum lines the marrow cavity, incomplete cellular layer. Where layer is incomplete, osteoblasts and osteoclasts can deposit or remove matrix components. Shallow groove formed by osteoclast called as Howship's canal or Howship's lacunae. Shallow groove formed by osteoclast called as Howship's lacunae. Here bone matrix you can see endosteum. From the endosteum side you can see the multinucleate osteoclast destructing cell. The composition of the bone matrix and cells we divide. Matrix consists of organic and inorganic components. Inorganic components always will be minerals like calcium and phosphorus, and organic components consist of collagen, mucopolysaccharides, and non-collagenous proteins. And cells, as we have already discussed, osteoprogenitor, osteocyte, osteoblast, and osteoclast cells. Inorganic content give rigidity to the bone. This is important to know. Inorganic content will give rigidity to the bone, whereas organic content will give the elasticity to the bone. Lack of inorganic content leads to soft bone. Lack of organic content leads to brittle bone, leads to Lobstein syndrome. Intramembranous osteogenesis or intramembranous ossification. Bone formation directly from the mesenchymal sheath formed by collagen fibers in between the mesenchymal cells, not the common process. Also called as dermal ossification because it presents in deeper layers of dermis. Roofing bones of skull, clavicle, and malleable are the examples for intramembranous ossification. Here you can see the developmental center of ossification, formation of trabeculae in this diagram. Then osteocytes deposit mineral salts. Here the biochemical role will come again. Development of periosteum, spongy bone, and compact bone tissue. Then the endochondral ossification. Most bone formed by this way. Cartilaginous model is replaced by the bone. Chondrocyte hypertrophy, degeneration, calcification occurs, and vascular invasion occurs, and finally leads to ossification. This is how we can see the bone formation, how the blood vessels are spreading, bone marrow towards the bone marrow, primary ossification center. And this is a spongy bone. Then Here you can see the bone formation. Endochondral ossification, finally bone will be formed. Then the growth at epiphyseal plate. Growth, how the growth occurs. At epiphyseal plate, first one, zone of resting cells, zone of proliferating cells, and zone of hypertrophic cells will be the zone of calcified cells. So finally, if at the epiphyseal plate, the growth is there, so which increases in length of the person or length of the bone. An oppositional growth, increase in thickness of the bone. Here you can see occurs on bony surface, on the bony surface of the bone periosteum side. The growth occurs, we call it as oppositional growth, which increases the thickness of the bone. And bone is the dynamic tissue, so its composition varies according to the regulating factors. 99% of the body calcium, 80% of phosphorus, and 65% of sodium and magnesium is reserved in the bone. Calcium is needed for many physiological functions, so it is tightly regulated at normal level, 9 to 11 milligram per deciliter. I repeat, 9 to 11 milligram per deciliter is a normal level. And factors affecting the bone growth are the high level of calcium, then the calcitonin levels, and these are the factors. And parathyroid hormone and calcitriol, So these are the hormones which affect the bone growth. And the clinical aspects, subluxation, incomplete or partial displacement of a joint, dislocation or luxation, we call it as complete displacement of a joint, then fracture, loss of continuity of a bone due to the abnormal forces or due to weakening of bone, called as fracture. Break in the continuity, we call it as simply break in the continuity, is called as fracture. Then the types of fractures, you can see simple, closed, compound or open, comminuted, green stick, and not complete are common in children. Types of fractures, simple fractures. Here you can see the simple fracture, open fracture, compound fracture. Then the bone disorders, osteopenia, decreased in bone mineral density, called as osteopenia. Osteoporosis, loss of both bone salts and collagen content. And osteomalacia, rickets, loss of mineral content but not the collagen, called as osteomalacia. Rickets. Then bone disorders, Paget's disease, continuation. Abnormal bone remodeling lead to abnormal thickening of the bone. Consequences, osteomyelitis. Then inflammation of bone marrow. Osteomyelitis means inflammation of bone marrow, most commonly by Staphylococcus aureus microorganism. Then bone disorders, continuation. Osteogenic carcinoma, called as osteosarcoma. It's a bone cancer that affects the osteoblasts. Then skeletal system, as we know, skeletal system consists of it's a supporting framework of the human body. So axial skeleton is composed of, divided into two skeleton parts, axial skeleton and the appendicular skeleton component. Axial skeleton component consists of along with the central axis of the body, the skull, the vertebral column, the thoracic cage, whereas the appendicular skeleton consists of the upper and lower ribs, limbs, and the bones that hold the limbs to the trunk of the body. So these are the appendicular skeleton. I repeat, the axial skeleton consists of the vertical axis of the body, whatever the bones consist of, like the skull, vertebral column, and the thoracic cage. And the appendicular skeleton consists of the limbs, both limbs, upper and lower limbs, and that hold the limbs, the trunk together. The junction between the trunk and the limbs also included in the appendicular skeleton. Thank you very much. We'll continue with the biochemistry lecture.